Hi, my name is Susan Shelmerdine. I'm an Associate Professor at University College London and also a consultant paediatric radiologist at Great Ormond Street Children's Hospital in London in the UK. My areas of interest are children's imaging, AI and also post-mortem imaging.
We will get to AI as we must, but could you talk about post-mortem, the work that you're doing and the role of radiology in that and what you would like to see for better dignity, compassionate care, etc.?
Yes, absolutely. So I work in a children's hospital rather than an adult hospital, and we can do post-mortem imaging both for children and for adults, although there is a bit of nuance as to when you might do it and how you might do it for a child versus an adult. I'll speak about adults first because that's much simpler. In adults, we use CT scanning. We scan from the head to the toe and we take a look inside the body to see if there are any causes of death or pathologies or diseases that we can find out to explain why someone may have died. We don't do it for every single person that's died. It's only people who have suspicious circumstances or who were possibly quite fit and healthy and we just have no clue why they've died and we need to find out so we can issue a death certificate. The reason we do this now as opposed to an autopsy is primarily because we just don't have enough pathologists. It's very time consuming to do an autopsy and families find it very, very distressing. And just like you or I, if we went to hospital with a painful head or a painful abdomen, we'd get a scan of that area. We wouldn't sort of examine everyone and open them up. So why would we do that for the dead? That's what we do in adults, and in adults actually we can get the cause of death in about 80% of cases. And we know from our pathology colleagues that they really like it because it saves them time, it's more efficient, and many of them have upskilled in learning how to report these CT scans without necessarily having to go to a radiologist unless it's very, very complicated. In the children, however, it's a slightly different story. We use the imaging not so much to replace the autopsy in the older children, but as an adjunct so that we don't have to do quite as invasive an autopsy, and also to help us get more information if children have died unexpectedly, whether there's any sign of child abuse, which then would be a safeguarding issue for any remaining children in the family. And we also do it for children that never technically lived. So by that I mean stillbirths, miscarriages, terminations of pregnancy. There is no real legal requirement to investigate their deaths because if they never lived, then they can't really die and they don't get given a death certificate. But of course, parents who have lost a baby really want to know why that's happened. They want answers. They want to know whether they have to be worried about it going forwards and if they have to have any other family planning kind of consultations. So we can also do some imaging for those. Mostly it's MRI or a special study called micro-CT. And a lot of the time we can find an answer. Or even if we don't, the reassurance to the parents is just amazing. So much of the time they're blaming themselves. Mothers are asking themselves, was it that curry I ate? Was it that Pilates class I took? And just being able to say, you know what, it really wasn't. There's just nothing we can find. Please don't worry about it, is just very reassuring to them.
And are you seeing a natural progression towards good care in that way in radiology, or do you have a call to action from your colleagues?
Well, I would just like more of them to explore how we could provide this service. It's a little known service and talking about death is quite taboo and people don't really want to invite that conversation because they're worried about upsetting people when actually there's a huge community of people who are in such pain and who really wish they had some closure and really want to talk about it. So I would say if you don't offer that service right now, maybe find out how you could speak to your local community. There's a whole community of religious people who are of Islamic and Jewish faith as well, where autopsies are really frowned upon in their societies and they would love to have a post-mortem imaging service. In many parts of the UK, they are fundraising themselves and not relying on the state because they want to make this happen. So the willingness is there. I just think we need to come together to form something that's sustainable.
And does that actually require a systems approach? Because I was assuming, okay, if there are two technologies able to do something, one can do it better, they would be the natural options that applied in each case. That's not the case, yeah?
Well, the thing is we just have autopsy at the moment or nothing else. And the way it is that parents, patients, bereaved family members, they want answers, but they don't want it at the risk of having to undergo a second traumatic experience, as in the autopsy. So they're left with absolutely no other option. Either you have no answers or you go for the most dramatic, traumatic, emotionally distressing option. And there's no in between, whereas imaging can provide that in between, and in some cases even give you the answer you want. So I feel like that is the way we've got to try to think about imaging in this space.
Fantastic, thank you. Now we move on to another thorny issue, AI. That's your big area of research, interest, etc. Can you tell me what's exciting and what are the perils that you're most focused on at the moment?
Well, the exciting thing is we've now got this amazing technology which is more intelligent, getting better every single day, and we're finding so many new uses for it in the most creative, imaginary ways. And all of us have access to an AI in our pocket now with technology like ChatGPT, Gemini, Claude, and so I think all of us can kind of see the power of this new technology, but I think we also know the dangers of it. For example, it doesn't always tell you the truth. It also makes mistakes, and it makes them in very, very convincing ways that's very hard to spot when it's going a little bit haywire. So how do we make that safe, but also make use of the incredible power it can bring us? When we use technologies like AI in healthcare, we don't use standard run-of-the-mill technologies like ChatGPT because we need things that are regulated and evidence-based for healthcare, so they need to have regulation. However, of all the regulated AI devices that can be used in healthcare, of which there are probably about 1,000, 80% of them are for radiology or medical imaging type tools, and less than 20% of them, about 17, are specific for children. So they are really being ignored and left behind. And I really do worry that people aren't aware of this and they're using tools that aren't developed for children on children and then having dire consequences because it will be making more mistakes.
What are those dire consequences? Have you seen any examples?
Yes, I have, unfortunately. So one famous example that has come from the United States a few years back is they had an AI tool that would triage on-call CT heads. So if someone came in through the emergency department and had a scan of their heads, it would be the first thing that would go through the imaging, and the AI would bump all of the abnormal CT heads to the top of the list and put all the less abnormal or normal heads lower down on the reporting list. So the radiologist would pick the most urgent cases off the top that could then be transferred for more urgent care. Unfortunately, this tool didn't work for children, and so the AI wouldn't process any scans that were done on children. The radiologist didn't know, the technician didn't know, the clinicians didn't know. And so what happened was they had a child with a head injury who came in who had an abnormal scan. That scan was not bumped to the top of the list. It was pushed down because the AI didn't know how to read it. And it wasn't actually recognized until several hours later when the patient deteriorated. And this was a hugely serious case, and really flagged up the importance of highlighting who are these tools for, when are they used, when are they not used, because people don't necessarily think about it. They think it's here, it's for CT heads, therefore it must be for everyone.
Beyond your radiology profession and your daily life there, that you have concerns about AI for children in any case. You talked a bit about that today. What are they?
Well, we've heard about the very famous case recently where ChatGPT informed a teenager who was feeling very depressed and suicidal how he would go about committing suicide. We don't know that there are appropriate safeguards in place. The AI tools are designed to be sycophantic, to feed delusional beliefs, to be very pleasing and validating to you, and we don't know where to draw the line necessarily until people push the boundaries and then suffer the consequences. I worry that now people are becoming very dependent on AI because it's the convenient option to take. And I worry that children who are growing up in an AI environment don't know any better or have never been forced to think for themselves. If they want to know anything, they just ask AI. If they want to chat to a companion, they just ask AI. If they want to figure out what to do with themselves for an activity, they ask AI. So are we finding that people are getting more and more involved with their AI as a companion and not talking to other people and forming those social bonds and connections, we've got to remember that an AI, although very friendly and very helpful and always available, doesn't have any responsibility. It doesn't care if you're sad or happy. It doesn't have any empathy. It mimics it. But you know, if you're in dire straits, it's not going to be there to bail you out. It's not there to comfort you, to hold your hand, to help you work through your problems. And it doesn't have any boundaries. And of course, when we grow up and when we try to learn how to negotiate with other people, we have to have boundaries. Whereas if you have an AI that doesn't, what does that mean for your social development and the way you think about the world and the way you negotiate in the grown-up world as well? So yeah, I worry about that a lot.
And you were recently on BBC TV talking about an issue raised by a Microsoft leader. Can you talk about that?
Yes, so the Microsoft CEO, Mustafa Suleyman, was worried that he was seeing more and more examples of people reporting AI psychosis. Now, that is not a medical term or a diagnosis, but it's a descriptive term that we're finding where some people who are prone to medical and mental illnesses are getting quite sucked into delusional beliefs that their AI is feeding them. The AI doesn't know the difference between role play or a psychotic attack. And so it'll feed delusions and it will try to validate you as much as possible. And many people have started having very, very strange beliefs, like there's a human in the AI that only they can speak to, or that they're going to be a millionaire, or that they suddenly have superpowers that only they have, that nobody else has. And that's causing them to really have very, very strange kind of belief systems that nobody else has. And because they're not talking to people, these things just get perpetuated. So I was very worried about this because I don't think it's just the people who are unaware or with mental illnesses. I think anyone could be prone to this, maybe in not quite as an extreme way, but definitely in some way, shape or form. And I thought it was important to raise that possibility and just to say, you know, it starts off very, very slight, like a small little belief that you have. The AI validates it, you then get pushed a bit further, you get validated more, and before you know it, you're so far gone.
And of course it's affecting our democracy and our politics and our civil life in many of those ways. Susie, thank you very much. Thanks. You have a Substack. Would you like to tell people how they can follow your work?
Yes, sure. Well, the easiest way to follow me is Susan Shelmerdine on LinkedIn. However, my Substack newsletter is called The Ultra-Processed Mind, and it's all about how AI is influencing our decision-making abilities and cognitive thinking.
And you have a book coming out.
I do, of the same name. It's called The Ultra-Processed Mind, hopefully out next year. Thank you so much.
Thank you, Susie.